It was 2017. I was near the finish line, waiting for Peter with their kids. A friend got a good picture of Peter near the finish line. And looking back, it's not a good picture. He's lucky he didn't have a stroke or worse.
I'm Peter Macy. I'm 46, and it's hard to pinpoint it, but I would say it's probably 6 or 7 years when I saw sort of the beginning symptoms. I would go out and relatively early into a workout, suddenly it would feel like lactic acid building up. My legs would start to get kind of heavy and crampy. And then at some point, start to get sort of short of breath earlier than I should have. I would be nauseous, get this pounding headache. Sometimes I would be borderline passing out, have to sit down, and my heart would just pound. I didn't, put everything together. I'd had doctors I was seeing, but because of a pre-existing historical problem with a heart arrhythmia, it was just take it easy.
Oftentimes when we're younger, we feel that we're invincible, it can't happen to us, we can't feel poorly, so we kind of try to explain it away.
When he got sick to the point where he's, vomiting in the bushes, I said, time out, that's not normal.
At that point, it was a decision to kind of own my own medical care and take a different path than I'd taken, and went through a number of tests. My endocrinologist said, this is a marker of something that's usually this rare kind of tumor. And I went and had a CT scan, and there it was.
And I can tell you which aisle of Trader Joe's I was in when I got Peter's phone call saying, yep, here's what I have, here's what it's causing. Okay, let's make the appointment and get it fixed.
At which point, I was referred to Dr. Roman.
He had a paraganglioma, a tumor that grew near the adrenal gland, but it was not related to the adrenal gland. They can be quite rare.
Mine was tangled in with, I think, the main artery to my kidney, as well as my vena cava, which is the artery that kind of serves your whole stomach center. So my picture of it is a little bit of a grape tangled up in a bunch of vines.
The hormones that the paraganglioma would secrete would really drive your heart to beat very fast. He could have gone to have a heart attack, stroke. He could have died, absolutely. It's sort of a difficult tumor to treat because you can't manipulate it very much. It was like a fireball. When you poke it and you touch it, it actually releases hormones because it gets angry. I sort of went in there like a big soft cat and tried to sneak up on it and gently just sort of pull on it gently without rupturing it. Accessing this through the back is called a posterior retroperiscopic minimally invasive approach. It gives a direct access to the adrenal gland and to some of these neighboring structures where the paraganglioma grew. UCSF is certainly one of the few centers in California to be quite experienced with this approach.
Within 3 or 4 weeks, I was running again. It was amazing to go and just run up a hill and have your body do what it's supposed to do.
On pretty much every run or bike ride since then, he's come home and said, it's amazing. He appreciates kind of the mental load, the emotional load off of his back, that he's not as worried about it.
It's one of the huge benefits of living in San Francisco is that we have UCSF and we have physicians like Dr. Roman, who's the pioneer in her field, probably the best person, as I understand it, certainly in the country, at removing this very, very rare type of tumor.
We can cure people of their disease. We can look them in the eye and say, this is gone. You can go back to being yourself, back to normal. You no longer have this.